probably when I was 15. Grandma was in the hospital, and one of the nurses, I didn't like the way that they treated her or our family, and it kind of impacted me to, go into the medical field and try and make a difference as far as, trying to treat people that you're caring for like they're somebody else's family member. So the program that you would need to go into for nursing, there's two different programs that are out there. There's a 2-year program, which they call an ADN, and then there's a 4-year program, which they call a BSN program. I did the BSN program. The ADN is something that a lot of hospital systems are weeding out, and they're trying, really, some of the systems aren't hiring ADNs anymore, so the preferential program would be the BSN. A typical day for me, I work midnights, so I usually start my shift at 7 p.m. We get there, the charge nurse comes in and they give us our assignments. Our assignments are based on our rooms. We're usually assigned to 3 to 4 rooms, and that's how many patients we're responsible for throughout the night. So on a busy night, you'll have 3 to 4 patients, and you'll be caring for all of them simultaneously. And they vary, in illness from patients who need to go to the ICU to patients who come in with an ear infection. So you never really know what kind of patient you're going to have or what you're going to get. Some patients have a large medical background, so they have a large history, and they've been hospitalized numerous times, and other patients are really healthy. So when I start my shift, I always make sure I go to each room, assess my patient, introduce myself to the families, and then check orders and make sure the previous nurse did everything that they were supposed to do so nothing's missed. And you just go from there. You kind of just go, take each patient one at a time, and you make sure everything's getting done for them. You speak with the physicians, you find out what the plan of care is, and you prepare your night, and you try and stay organized. Sometimes it can get busy. If you have orders on every single patient all at once, you have to prioritize and figure out who's sick, who's not sick, and whoever's sickest gets what they need done first. So it's just a balancing act throughout the night. Some nights go better than others. Some nights kids aren't sick, some nights they are. So I would say that's a typical day in the ER for me. Some of the positives and negatives of my job, I would have to say that the positives for the most part outweigh the negatives. Working with kids, it's very rewarding. You're the person that they look to for everything while they're in the hospital. They smile, they thank you. Sometimes you get hugs and they color pictures for you, or you get to the feeling of knowing that you were involved in their care to help make them feel better. It's just a really rewarding experience to know that you had a part in helping somebody feel better. Not everybody comes in and leaves and goes home feeling better. Some patients have to stay in the hospital and they're sick and they don't get better. But knowing that you're part of their care and you're there for the families and you can be an emotional support to them is probably the biggest positive of my job. The biggest negative, I would say, is that as a nurse, you are everybody's punching bag. So if a family member or a patient's having a bad day, you're the one they take it out on. If the doctor's having a bad day, you're the one that they take it out on. But it's what comes with the territory. It's what comes with the job. As long as you know how to handle yourself in those situations, everybody has a bad day, and unfortunately, the nurse is just the person who gets the brunt of it. But I would say for the most part that doesn't happen very often, and the positives of my job definitely outweigh the negatives. Is that good? Mm-hmm. So the job outlook for our occupation, I would say, is good. I wouldn't say that we're necessarily on a shortage like we used to be, but any position in the medical field, there's really good job security. You very rarely have to worry about, especially as a nurse, losing your job or them downsizing. Especially where I'm at in the emergency room, they usually overstaff because you never know what's going to come through the door. But any job in the medical field, especially nursing, I would say is a good career move, and you would be, financially stable and have benefits. And so I think there's definitely a good outlook for our occupation, and there's definitely a lot of areas to advance and go on with your education in nursing as well. If I had to give somebody advice about going into nursing, it's definitely an individual decision. It was the choice for me. It doesn't come without its challenges. It's not an easy job. It's hard. There's days that are easier than others, just like any job. But you have to be willing, you have to be able to work with blood, work with, lots of different bodily fluids that people aren't necessarily comfortable with. You have to be able to, poke people when you're starting IVs, or poke people to give medications, or be able to hold somebody's hand and comfortable emotionally, supporting people through their hard times. And sometimes people die when you're taking care of them. So it's not for the faint of heart. I would say that you have to be emotionally strong, and you have to be a hard worker. You have to be willing to learn, and you have to be a good communicator. And I think if you know that you're a hard worker, and that the medical field is a field that interests you, I think anybody can be a nurse as long as they're willing to put the work into it. The job is rewarding, but I think for the most part it's a very individual decision, and you have to make sure that you do your research and you look into different types of jobs you could do as a nurse before you decide to go into it. But me personally, I would recommend it to anybody who has any interest in the medical field. I've seen a lot of things, and I've experienced a lot in my career, and I would never go back and do it differently. So.